Thank you to the organizers to have me out here. And thanks my lovely audience to tolerate me for another 10-15 minutes. I'm going to talk about something different than what we heard from our previous esteemed speakers. I'm going to take you for a while back to the arena where I work in. I work in a hospital, in an ICU setup. I deal with lot of negative emotions, but I'm happy and happy to share that I'm able to wear a smile on my face and tell my patients, don't worry, it's all going to be fine. So at a given point of time in a hospital, what a patient would be going through, that we need to, it's extremely important for a healthcare professional to understand. Be it a physical therapist, surgeon, CEO, director of the hospital, or someone standing right at the gate, the security personnel. So what the patient is going through, like this is the orchestra: anxiety, fear, misery, disgust, anger, sadness, guilt, uncertainty. I put happiness and excitement as last. Only those people who deliver a kid are happy. वो लोग ही मिठाई का डब्बा देके जाते हैं. Okay, so it's very important for us to understand what a person must be going through. We doctors at times, I'm not, excuse me, I'm also one of you healthcare professionals, but there are few of us who are very mechanical. They go to the patient, hello, how are you? Fever आया? ये आया? वो आया? Okay. खाना खाया? ठीक है. Problem हो रहा है? Okay, fine. ठीक है. Okay. निकल जाओ. Instead of that, there are other doctors. I practice that. I go to the patient's room. I said, hello, Mr. Shah. How are you today? I am your physiotherapist. My name is Bijal. How are you today? Did you have your breakfast? Did you like it? Oh, the dietitians are very raw breakfast. I don't like it here. Little bit of masala, samosa or something will help out. I know that the patient cannot have it, but taking the person out of that current mental state for a moment would do a great healing to the body. It's just one insight to the patient's mind that what he must be going through. Did you sleep at night? Is this okay? Is this environment okay for you? I know the answer is no. Nobody is happy being in the hospital apart from us because we get salary. Right? So just few simple words which we talk about will make a lot of difference also to the relative, because he is bichara going through this entire emotional orchestra plus worried about the finances. What's going on? अरे ये टेस्ट किया, वो टेस्ट किया, कल तो बिल 2 lakhs का था, आज वापस 3.5 लाख का हो गया, 1.5 लाख का क्या कर दिया इतना? Right? We have come across this kind of situation. 1.5 lakhs. What happened? Now, what I keep telling in my speeches to the universities also, but they don't follow this. In a medical colleges, nobody teaches us how to prescribe positivity. We know, all the doctors would know to prescribe medicine. I would know to prescribe physical medicine. I can write, oh, ye problem hai, shoulder pain hai, this, that, you do this, you do this, you do this. But nobody would prescribe positivity. Why? Because koi pharmacy ke paas hota hi nahi hai positive emotions. They don't have it. So all I want to say is, try and understand what a patient would be going through. First of all, being sick is definitely not a good feeling. Secondly, the very fact that he or she knows that he is in the hospital means, what he must be thinking, kya ho gaya? Is my illness so not controllable that I have to not be treated at home, but I am admitted in the hospital? Third thing, if he or she is in the ICU, oh my God, what happened? Why am I in the ICU? I don't like this monitor sounds. This AC is too much for me. I'm not comfortable in this bed. The first discomfort starts at the time when the patient is in the bed. One simple thing, we are all used to our own mattresses at home. Okay? If I stay anywhere, in a 5-star hotel or any hospital, there are nice soft mattresses. Initially we feel good, but 2 days we start having neck pain and back pain, right? They are not comfortable. The food is not great. The hospital staff, they are all strangers to me. I am not comfortable being among the strangers. Anybody comes and does whatever to me, they think I am what? So this insight needs to be there. I don't like the food. I like my homemade food. They don't allow me. My family is not around. Nurse comes and pricks me here, pricks me there. The ECG technician comes and opens my chest. Boss, I am not comfortable being naked in front of the strangers. Hence, it's extremely important for the healthcare professionals to understand that this advice from a patient, I will just read it out to you guys. This may be a normal day at work for you, but it's a big day in my life. The look on your face and the tone of your voice can change my entire view of the world. Remember, I am not usually this needy or scared. I am here because I trust you and I have confidence in you that you would do something good to me. I may look like I am out of it, but I can hear your conversation. I am not used to being naked around strangers. Keep that in mind. I am impatient because I want to get the heck out of here. Nothing personal. I don't speak your language well. You are going to do what to my what? I may only be here for 4 days, but I will remember you for the rest of my life. And your patience with me, I am your patient. I need your patience. All that would make, see, a simple thing like a smiling face, your own body language, your happiness will matter a lot to your patient, and you will indirectly converting his illness to a wellness, including physical and mental. So as doctors, we need to really understand, not only doctors, even as visitors, when as relatives, when we go there, as visitors, it's very important for us to we just go there, अरे क्या हो गया? अच्छा, fever आया, कैसे हो गया? ये हो गया, वो okay, ठीक हो जाएगा. But just, why don't we go with this mindset? Hey, so what? It's okay. आज यहाँ पे हो, 2 दिन के बाद में वापस आ जाओ, come back. I'll meet you there, maybe with khaman dhokla and khandvi, and we'll have fun. ये कोई नहीं बोलता. So this is what I urge the medical school to teach their students to prescribe positivity, to learn bedside mannerism. ये कोई नहीं सिखाता है. I am both from a private institution, both from a government institution. Nobody taught me this. When I became a patient, then I realized, boss, what were you doing to your patient? So with this, all the patients would need is care with a smile and compassion, and an assurance with a pat on the shoulder, which would say, don't worry, I am with you. You are not alone in this journey. Don't worry, you will be fine. I think I'm done with my slides. We practice a lot of recreational rehabilitation at our hospital, where once the patient sits, these are highly critically ill patients. So once they are able to sit, they are able to understand, we make them play, literally nostalgia, we make them play board games, Saap Sidi, chess, and literally they land up cheating with us and they win. So that's what, and also I would like to share one very good thing which we do at our hospital. I am the leader of that project. It's a quality improvement project where we, especially those patients who are undergoing, currently we are targeting only bypass surgical patients. So those patients who are undergoing bypass surgery, they get admitted 1 or 2 days prior to the surgery, and we go spend nice 45 minutes to an hour with them, with the relative as well, and we teach them we tell them what's going to happen after the surgery. There is a lot of fear, what will happen to me, what will this, and the very fact that I have witnessed this in my practice, that the relatives, when they come to see the patient post-operatively in ICU, they see the patients with a lot of tubes and lines, and this, we have experienced relatives fainting, and then there is again one more emergency. So imagine today you are able to talk, but tomorrow after the surgery there is a big tube in your mouth and you are not able to talk. How do I convey I'm uncomfortable? There is a tube here, tube there, my body is full of tubes. But it's always good to tell them pre-operatively, there is these are going to be there. Don't worry, everything is going to come out. This is all to support you. You will not be able to talk. We will not be giving you water. Your all other needs will be taken care of. There will be a nurse around you. She will be unable to understand your gestures. I will be coming as a physiotherapist. Your relatives will be there. This. Trust me, in my project, we have found that they are when they are very more compliant towards physical therapy sessions, towards the treatment, and their anxiety and depression levels are lesser compared to the pre-operative levels. Yeah, I think I'm done boring you guys. Any questions that I can answer?
Hello, yeah, thank you so much. My name is Bruno. I come from the Middle East. I'm also one of the speakers, so great session. And this is what we practice. You have rightly said, informed consent. So informed consent, information given prior to surgery definitely reduces.
Yes, absolutely.
Absolutely. The other one question I would like to ask, because I've been always, it's been 3 decades into healthcare. I'm from Mumbai, but now in UAE and Middle East and Saudi. What I have noticed is the empathy part, the compassion part. What I've seen with all, I know a lot of students are here, and I've been always interviewing new students, new cadres coming into healthcare. What I noticed is to practice empathy and to practice informed consent, to be compassionate towards them and go the extra mile. I would always like to ask all our newcomers that they need to understand the system first. So what everyone does is the moment they enter a system, they do not know the system. So half of the time goes into understanding the system. And the empathy and the compassion gets left out. So every person, so I feel there should be a kind of, that's what I wanted to know, how in HN you all are using this model where you all are training them, because what I notice, newcomers, until and unless they don't know the system, they will not be able to go the extra mile, because all their efforts are gone into whether I should fill in the prescription, I have to carry on the doctor's orders, I have to do these blood tests, I have to send this order for a MRI or a CT scan. I don't know how much insurance is in India, but this is the whole effort. So do you do something on training them, and then only they can go towards the compassion stage?
Yes. So, sir, there are 2 sides of this coin. One is, it is very much a personal trait. I cannot always make a person feel compassionate, or I cannot make him compassionate and try and make him understand that, okay, look what he or she must be going through. That is one personal thing. But I am blessed to be in an organization where our HR, right at the entry level, because they know this is all a clinical staff, and there are separate trainings happening for clinical and non-clinical staff. So the HR right at the beginning tells us how to talk, which none of the medical schools will teach us. Bedside mannerism, how to talk, and this, ये जो poem है मैंने उधर से चुरा है. So they literally make us feel that this, the person you are dealing with is already troubled, already, not in a good frame of mind and body. So they teach us how to deal with such a patient, and rather every patient, because nobody is happy being in the hospital. So that is there, but beyond this also, not that the HR has been successful in training all 100% people and converting them into compassionate individuals. It is a personal trait. How much you gain from it, how much you take from what you are teaching, what you are learning is also a different thing. And I have still seen people coming in my own organization though I'm boasting about it, but I've seen people, anesthetists coming there and okay, telling patient, आपको कल anesthesia दिया जाएगा, sign. अरे but क्या होगा वो तो बोलो. The patients are surprised when we tell them, अरे when you were undergoing surgery, you were on ventilator. They're like, what? Was I on a ventilator? And I'm right now, I'm not on ventilator. They ask me that. So that detailed talk and the rapport building is kind of like, getting shadowed due to the workload and, somehow that not understanding of that fear, anxiety, all the negative masalas of emotions which the patient must be going through. If we have even 1% of it, trust me, the hospital would be a very happy place, including for employee, to theek hai, but definitely for the patient and the relative. Imagine you are going to China, but you don't know any language, you don't know anything. Suddenly I tell you, नहीं चलो China पहले लंदन जाते हैं, पर लंदन जाने की जगह पे फ्लाइट चाइना में लैंड हो गई, and I go to London and you are there. You don't know Beijing जाना है कि शंघाई जाना है. You are just there. You just know you are in China. You just know you are in hospital. आगे क्या होने वाला है कुछ नहीं पता. So similar situation, how we would undergo, how we may feel the fear, the anxiety, the uncertainty. The same way a patient who's bichara suffering and also giving money is also having the similar kind of situation, which we all must understand as healthcare professionals, as relatives, as patients, and as a human being. We need to, in short, I want to give a small messages. In hospital is a place where we get lot of blessings. I always tell my patients after the session, all right, now you give me my fees. So they say, tell this to my my relative, he will pay for you. I said, I don't want money, I want blessings. And when they say, God bless you, oh my God, it's like I got one full bag of all good deeds, ताकि मैं ऊपर जाके बोल सकूं भगवान को, पाप तो है, पुण्य भी किया है. Okay, thank you so very much for your patient listening. Thanks a lot.